Hi, my name is Cheryl Fox, Director of Patient Safety and Improvement with the Sunrise Health Region. The Patient Safety and Improvement Unit oversees a variety of patient safety and improvement initiatives across the region, of which the Releasing Time to Care program is one of our key initiatives. The purpose of the visit is partially about learning from the staff what is working well and what are some of the challenges they face, the barriers that maybe are preventing them from getting the job done the way that they would like to see it happening. And I think a good part of it too is just sort of reinforcing the empowerment that they have as staff members in making changes on the unit. I think it's a great opportunity for staff to be heard and encouraged in the hard work that they are doing, really acknowledging that we're all in it together and together we're going to make it work. And I know we had some discussion at the board meeting today about the audit sheets. Is that just maybe thoughts on whether you think that's going to help sustain?
If things are being checked, you're more likely to keep everything in line, keep everything organized because it's being checked. If nobody's checking, who cares if you put it down there or put it away or
go back to old habits.
Exactly, yeah. So I think it will help to keep things organized and in line.
The visit happens monthly. Usually prior to the visit I'm looking at my previous visit notes and what at that point there was usually some triggers for further conversations that I wanted to have on this visit. So I guess when I think about what I bring to the visit, it's essentially the desire to learn and questions to enhance that learning. And I know at the get-go, and I initially brought like a pen and paper because my memory is not always that good. And that was, I think, a bit disconcerting for staff at the beginning because they thought I was, really taking notes on what they were saying. But I think everybody's at a comfort level and realize that it's just my memory. Hi, Francis.
Hello.
I just was wanting to follow up from the board meeting from last time. And at the time, I think you were just starting to use the whiteboards on the patient rooms.
That's right.
And just wondering how that's been going.
I've been getting a lot of positive feedback, which I'm very happy to hear. The patients so appreciate being able to interact with their nurses and know their nurse, not the blonde lady or the one in the blue uniform. To
be able to call them by name.
Yeah, it's good to have that personal interaction with our patients and with the families as well. It's also to my benefit if I get a phone call and I know exactly where that nurse is, which team she's on for the day, and again, if the patient-nurse relationship goes smoother.
So you don't have to go doing any running around finding out who's looking after who.
Yeah, question 3 girls to find out who the nurse is.
So in your corner, it's working quite well then.
Right.
Oh, that's great to hear. Thanks so much, and we'll maybe talk to you. Well, I'm sure we'll see you before then, next visit. All right. Bye-bye. Bye now. I also think it's a great opportunity to reinforce and connect the dots around our strategic direction, both as a region and as a province, in trying to achieve that overarching goal of improvement system-wide. It's a great opportunity for us to be involved in proactive conversations with patients and families, and demonstrates that I think we are committed to hearing their voice and improving the patient experience. The last 3 weeks that you've been in care, as you think back on that, is there one thing that you feel is most important to be considered for patients every time that they're in care?
I lived it by myself for years, and a lot of people around, I just let them go do what they want to do, and I sit back and watch.
Yeah. So it's important to you when you're in care to have that privacy and have people respect that you don't like a lot of people around.
Anyway, when they have to be around, they have to be around.
Right, yeah.
Especially when you're in a hospital.
But it's working better for you now that you're just in a more private ward.
Yeah.
The importance of the patient voice is one of the most powerful feedback mechanisms that we have for improving our system. One of the initiatives that they've been working on is trying to ensure patients and families know who their nurses are. And one of the things they were trying was having a whiteboard on the door with the nurses' names. From your perspective, has that helped at all, or is there ways that they could make it better? Or?
Well, from where I am in the room, in behind the door, I don't see that unless I'm walking in and out of the room.
Right. How about Arlene, from your perspective, things that you maybe have seen that could be better? Or?
Well, I have found them very, very good to me, that when I ask a question, they answer, and I always we like to keep track of Ray's blood work, and they've been very good at answering all our questions and to give us the numbers, because Ray has kept a flow sheet for 22 years, ever since his transplant, and it's very nice that they consider me part of him. It's so much nicer to deal with having to be sick, and if you have a cheerful,
What do you call it, disposition or whatever?
Disposition, and
that can make the patient journey a lot better when you're not feeling well.
yes.
The significance of signing the pyramid visit after the visit, I think it just demonstrates to staff, like, not everyone's able to be at the board meeting, and it demonstrates that we were there, and also as a trigger for them to review the results of the visit and feedback that we talked about at the visit. It does take time to prepare for the visit, to conduct the visit and write the follow-up report. I think that can be challenging with busy schedules. Usually I try to do my report right up the day of the visit. That's not always possible, but it's certainly easier if you do it the day of the visit. Sometimes during the visit, there's flags that go up for me. It could be a patient safety issue that staff have raised, or a patient concern. And so I will just follow up, usually with the manager on the unit, as to next steps. I see you had a fall here on the 15th. What actions does that usually trigger on the unit when you have a fall?
Well, we do have a falls protocol that we follow, depending on whether it's a head
in the summary report that I do, it just sort of includes an overview of where the unit is at with their measures, any comments that I might have around that, as well as feedback that I have gotten from staff around what's working well, what could be better, and then a summary of the feedback that I've obtained from patients and families. There's as well just a spot for general comments or reflections. In those areas, I think I often will extend like encouraging thoughts, I guess, as well as some of my own reflective thoughts on just what we're trying to do in the system overall. Usually on that report, I would make a note of things that I want to follow up on the next visit. RTC and QI work is hard work, and I really have been impressed with this team's resiliency and patience and perseverance to commitment, actually, to keep going at it at times when I'm sure it would have been very easy to have said, enough, we don't have time. Kudos to the whole team. I think it's been almost a year since I started doing the pyramid visits, and the one thing that I have been really consistently impressed with is I really get pumped every time I get to talk to frontline staff and patients. All of our pyramid leaders would agree that really what better opportunity could we have to connect with patients and families. And I think as pyramid visitors, I think really view it as a priority and a privilege to take part in. Always knowing that in improving quality, it's really at the front line that we're going to make it happen. And so really embrace those opportunities for conversations. In fact, I wish I sometimes could do it more than one visit.